And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So a little healthy competition, always good for the soul, right?
I don't really have a problem with that. I mean, dieting and exercising can sometimes be very boring, and you do need some other sort of incentive, so cash reward sounds very good to me. I don't have a problem with that. But the problem is that at some point it goes away. You need to just kind of fall back on the same old things that we tell everybody. It's hard to do out there, but those things do make a difference. And so it sometimes can jumpstart patients to eat right and really learn how to eat right, be healthy. So I don't have a problem with that. You always hear that in the offices of businesses. There's always a pool going around. So it's fun, it's exciting. So just always try something. Don't give up on your health. We know it's frustrating, so just keep trying to figure out how it works for you.
Sometimes they even have those friendly competitions within the gyms themselves.
Absolutely. And there's nothing wrong with that. Again, it's very boring just to wake up and go to the treadmill every day, eat the same old food every day. So whatever it takes, we just want people to be interested in their health, invest in their health, because it is very important. The things that you eat and drink every day and the sedentary lifestyle that we typically have in America is just bad on your health. So just do whatever you can.
This person wants to know, looking for the best diet suggestions for heart health.
Really just the basic things that we say all the time. It hasn't changed in years. Try to get more vegetables, at least 4 to 5 servings a day. Serving is typically the size of your fist. Try to eat more vegetables, whole grains, fruit. Such as blueberries, strawberries, raspberries. Try to limit the bananas and the watermelon. That doesn't really have a lot of antioxidants and vitamins in that. And certainly try to get exercise, typically 4 times a week, 20 minutes at a time with moderate intensity.
Now, you talk about the size of your fist. Now, there are some guys out there with really big fists. That's not fair.
I know, typical. But typically, if you eat healthy food all the time, studies have shown you typically lose weight, because a lot of times you're supplementing that. You're not eating the junk food that's high calorie and calorie dense.
All right. Some more medical questions. This person wants to know, are there any prescription medications that can cause liver cirrhosis and or fatty liver infiltrated, or does IDDM, Graves' disease, or any autoimmune condition contribute to the above conditions?
Fairly long question. In terms of medicines, no, I don't know that. We're always concerned about liver toxicity from most medicines. They typically don't cause cirrhosis. Most cirrhosis comes from viral hepatitis, and alcohol abuse can come from fatty liver. Again, we see that because most patients are overweight, and those other autoimmune conditions, diabetes, Graves' disease, typically can cause liver toxicity or liver inflammation, not necessarily liver cirrhosis, which is a scarring of the liver. So typically medicines, not necessarily.
Another question. I have horrible eczema on my hands that causes me pain, making daily living complicated. Any suggestions on what to do?
A lot of times you just have to use a very potent steroid cream, sometimes an occlusive dressing at night, so that the cream doesn't wear off. A lot of times you have to go to a dermatologist and use tablets, medicines that affect the immune system, so that you don't get the outbreak. So that sounds like a very tough location for it to be. So certainly those are things that we try in that situation.
All right, and we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person says they had 9 inches of their colon removed over a year ago. They had bright red blood in their stool every now and then, the doctor says, because of hemorrhoids. It's been more than a month. Could it still be something else?
It could still be hemorrhoids. I mean, hemorrhoids are a chronic problem. They typically bleed, especially if we're on aspirin and Plavix or Coumadin. I think the bottom line is, if there's any concern, you can always get it further tested, typically a colonoscopy, but that doesn't sound too unusual.
Okay, a 51-year-old woman with an abnormal EKG with high blood pressure and a fast pulse. What could it be?
A lot of times underlying heart disease. That's a big problem in America because of a lot of the risk factors: high blood pressure, high cholesterol, tobacco abuse. So normally can cause electrical abnormalities of the heart, especially if you have poor circulation or if you have a condition called heart failure. Some of that is aging. Unfortunately, as we get older, the electrical system.
But she's just 51.
I understand, but I'm just saying, because of certain risk factors, you could have it earlier. Some of these things are congenital. So if there is something abnormal, certainly get it completely checked out, typically with an echo, maybe a stress test, or maybe even an angiogram. That's pretty much up to the heart doctor.
Okay. How often should one get a pneumonia prevention shot?
Depends on the risk factors and the age. Typically for adults, normally at the age of 65, that's one-time injection. But if you have a lot of comorbid illnesses such as heart failure, diabetes, chronic lung disease, probably a lot earlier in your lifetime, and would get a booster at 5 or 10 years.
Okay, a 53-year-old woman had a partial hysterectomy 25 years ago. What could cause spotting blood now?
A lot of times you could have vaginal atrophy. A lot of times the vaginal area gets very thin, and again, if you're on blood thinners, it can bleed. Certainly I would have another repeat gynecological evaluation to make sure nothing was left behind, and to certainly look for other things, vaginal polyps, infections, tumors, so certainly get that checked out.
Okay. Can you get shingles, get a shingles vaccination after having the shingles, and should you?
You can. Typically, we're looking for the patients to prevent the shingles outbreak, but we still recommend it for those who've had an outbreak. It does reduce the frequency of having a flare, so absolutely we do recommend it for all those patients.
Okay. There is a spot on the bottom of my right ribs that hurts when you touch it, cough, laugh, etc. I played basketball on Friday. What could have caused it?
A lot of times with spots, we normally have to look at it. If it's suspicious, we biopsy it. Certainly if it's painful, that's not a good sign, so certainly wouldn't ignore it. Melanoma is always a concern, skin cancer, so certainly I would probably get that biopsy.
It's spring and we all know what that means. Poison ivy. Any tips on how to get rid of the rashes and how to keep it from spreading?
I think the best thing is avoidance if you possibly can. If you know you're allergic to it, just try to avoid certain areas, but the good old-fashioned antihistamines work very well, Benadryl, Claritin, Allegra. If it gets too bad, then prednisone, Medrol dose pack, or even some prescription antihistamines work very well, but avoidance is key.
Okay. For about 1 month, I've had an annoying cough. It's only when I talk and it's dry. Do you think it's allergies or something more serious? By the way, I don't smoke and I've never really had any allergy problems.
Perfect. She doesn't smoke. I mean, the 3 most common causes of a chronic cough would be postnasal drainage, asthma, and acid reflux. So the physician typically focuses on those issues to see which one exists and then treat them accordingly. But it is yellow dust season, so I would try just a trial of an allergy medicine first. I mean, you'd be surprised that those medicines are very powerful and can help with cough if it's related to allergies.
All right, Dr. Levine, as always, we appreciate you stopping by. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kfdm.com, or post those questions every Monday on our KFDM News Facebook page.